Claire Hawkey, to be followed by Alexander Stewart.
Thank you, Presiding Officer. And I would like to refer members to my entry in the Register of Interests, in that I'm a registered mental health nurse and currently hold an honorary contract with NHS Greater Glasgow and Clyde. Like other members present, I too know of constituents and friends who have either had or are affected by breast cancer or cystic fibrosis. The impact of these illnesses doesn't only affect the patients themselves, but also their family and friends who are supporting them. And like many across this chamber, I've heard of heartbreaking stories from constituents whose lives have been turned upside down by breast cancer and cystic fibrosis. And it's for that reason that I fully applaud the tenacity of the campaigns led by Breast Cancer Now and the Cystic Fibrosis Trust in calling on authorities to widen access to medicines for such conditions. Their campaigning has helped to educate MSPs and the wider public on the merits of widening access to these drugs, and for that we owe them a debt of gratitude. Presiding Officer, as we've heard, the Scottish Government has significantly improved access to new medicines in recent years. Figures show that between 2011 and 2013, the combined acceptance rate for orphan and cancer medicines was 48%, whilst in the last 3 years, under the new approach, the Scottish Medicines Consortium approved 79% of such medicines. And there can be no doubt that these drugs have changed lives. However, we can always improve and build upon our processes and learn from our own past experiences and evidence-based best practice from other nations. Following the recommendations laid out in the Montgomery report, I welcome the Government's commitment in reforming the systems which are currently in place and in introducing changes that will enable medicines to get to the people who need them. Only yesterday, as we've heard, the Cabinet Secretary for Health and Sport announced that the Scottish Government is introducing a new definition of ultra-orphan medicines, which will give the Scottish Medicines Consortium the ability to treat some medicines for rare orphan diseases as ultra-orphan medicines. In effect, the changes will mean that if the medicine meets the new definition of an ultra-orphan medicine and the SMC consider it clinically effective, then it will be available in the NHS for at least 3 years while information on its effectiveness is gathered. This is one of a number of steps being taken to ensure that access to vital medicines is widened. And with these new rules for medicines, faster access to new treatment will become a reality. Presiding Officer, I wish to reiterate that medicine approval decisions are not taken by MSPs, nor are they taken by government. This is the role of the Scottish Medicines Consortium, which, as the Cabinet Secretary said, rightly acts independently of ministers and Parliament. Nobody wants to be in a situation where certain medicines are rejected, and it's entirely appropriate that it is a decision that is carefully taken based on sound clinical evidence and by an independent body. Like others here, I welcome Roche's announcement that they are to make a new submission to the SMC on Perjeta, and I urge Vertex to do likewise for Orkambi as quickly as possible. But, Presiding Officer, we cannot allow our health service to be held to ransom by pharmaceutical companies, and we must encourage them to offer fair and transparent prices for their products. Everyone here is in agreement that we want these drugs to be made available to the people of Scotland. However, there must be fairness in the cost of the drugs supplied. I therefore welcome the commitment made by the Association of the British Pharmaceutical Industry that its members will provide Scotland with the same discounts offered elsewhere in the UK for accessing medications. Presiding Officers, Parliament has spoken today with one clear voice in calling for all pharmaceutical companies to play their part and bring a fair price first time to the drugs appraisal process. Quite rightly, people should not be losing out to profits.
Thank you very much.